A latissimus dorsi flap breast reconstruction. This is coded to 19361. And what is this procedure? So the latissimus, we start here. The latissimus muscle from the back is dissected. The muscle skin flap remains attached to that main artery. And then it's rotated to the front of the chest, which is tunneled under the armpit and extended through to the mastectomy incision. So if you see that documentation within the op report, then 19361 is the code that is coded. And if they also implant a breast implant, the coder would also add 19340. A tram flap, transverse rectus abdominis mycutaneous flap, otherwise known as a tram flap, is coded to 19367 to 19368. So again, if we start here, the muscle is, we start here. The rectus abdominis muscle is divided. It's passed through a connecting tunnel. And in this is, the muscle is divided, but it's kept to its blood supply, so it's never completely removed. You think of a flap. It's never completely removed. It's still attached to its blood supply. So it's passed through a connecting tunnel between elevated chest skin and inferiorly position. It's an inferiorly positioned flap, and then that muscle is contoured to make a breast mound on the chest. So that is what a tram flap is. Now, if one pedicle flap is done, CPT code 19367 is coded. If any additional if an additional microvascular anastomosis is performed, then 19368 CPT code is coded for that. And that is for connecting blood vessels that are provided. So our last slide in our integumentary and breast section, just a few tips. Again, 19302, mastectomy with axillary lymphadenectomy. It includes, this code includes the removal of sentinel nodes. No. How about some sentinel nodes? It's kind of nice that I can type while you guys are watching this. And then if dye, sometimes they will inject dye to see which nodes are affected. And that code, the coder would use 38792. With 19303, mastectomy simple complete. If removal of axillary lymph nodes, the coder would also code 38525. And then CPT code 19357 for a breast reconstruction with immediate or delayed with a tissue expander, including subsequent expansion. And a lot of times you'll hear this referred to as stage 1 for breast reconstruction. And patients that wish to begin their reconstruction immediately, such as the day of their mastectomy, the physician will place tissue expanders that are done at the same time. And usually a general surgeon performs the mastectomy, and then a reconstructive plastic surgeon will perform the insertion of the tissue expander. You'll also hear maybe stage 2 breast reconstruction, and that is when the patient now is going to come and have those tissue expanders removed and have a permanent breast prosthesis put into place. So we will go more into some more examples and coding scenarios when we meet on Wednesdays and Saturdays. So make sure to bring your questions. Thanks.